Good morning. Here is our fourth lecture in joint and bone pathology. Good morning. In this lecture, we will describe the pathological features and radiology of benign and malignant cartilage-forming tumors. Chondroma, it is the first chondrogenic benign tumor. It occurs in the middle age group. It is of two types, either enchondroma that go inside the medullary cavity causing rarefaction of the bone, or juxtacortical chondroma goes on the surface of the bone. If it's multiple, thus it is usually a part of a syndrome called Ollier syndrome. Microscopically, it appears as lobules of hyaline cartilage of low cellularity. With radiology, it appears as a honeycomb appearance of a circumscribed mass. Good morning. Here are some X-rays for the chondroma when it appears as an external growth and as an enchondroma with rarefaction of the underlying bone. This is the gross appearance, clarifying the difference in between chondroma and enchondroma, and under the microscope it is a benign chondroid lesion encapsulated, formed of lobules of benign chondrocytes inside the lacunae amidus chondroid matrix. Good morning. The second benign chondroid forming tumor is called osteocondom. It occurs at any age, but it's more in adolescent and childhood. It affects the long bones most commonly at the metaphysis, and it may lead to a pathological fracture. Grossly and radiology, it appears as a mushroom-like growth with a stalk of bone capped by cartilage. Good morning. Here is the gross appearance of the osteocondoma with a mushroom-like structure, and it's very well apparent as well in the radiology. The third benign cartilage-forming tumor is called chondroblastom. It appears in the young age group, and it affects the distal femur, proximal tibia, or proximal humerus in the epiphyseal region. It's usually solitary, and it is a well-circumscribed radiolucent lesion with a calcification. Under the microscope, it's a highly cellular with multinucleated giant cells, and the most important is the chicken wire calcification. Here is the radiology for chondroblastoma forming an osteolytic epiphyseal lesion. It is a highly cellular tumor amidus chondroid matrix with a chicken wire calcification. Good morning. The chondrosarcoma, which is the malignant cartilage forming tumor, it appears from the middle age to old age patients. It may occur in the long bones in the region of epiphysis, or maybe also in the irregular bones. It may be a primary or secondary to other lesions like enchondroma. It appears as a radiolucent mass with popcorn calcification, and under the microscope there is malignant chondrocytes amidus chondroid matrix, and degraded into 3 grades according to the level of atypia. Good morning. Here is the gross appearance of chondrosarcoma with a bluish chondroid matrix, and it appears in the radiology as an osteolytic lesion with popcorn calcification. Good morning. Here are the subtypes for histological appearance of chondrosarcoma, including the conventional, formed of condoid matrix amidst malignant chondrocytes. The second type is mesenchymal mesenchymal chondrosarcoma with mesenchymal less differentiated cells. The third type is a clear cell type with a clearing of the cells. The differentiated type is an high-grade type of chondrosarcoma, but still some chondroid matrix are still seen. The last type is the myxoid with excessive myxoid matrix. Good morning. Here is our fourth lecture in joint and bone pathology. In this lecture, we will describe the pathological features. Thank you for your attention.